My name is Ron Cleveland. I am a 67-year-old business owner who was born and raised in Fulton County, Georgia. I spent over 25 years working at the Clayton County Board of Education as a maintenance supervisor. Shortly before retiring with the board in 2000, I started a restaurant called Lunch on Main Street, located in College Park, Georgia. The restaurant provided stable work for a staff of 10 employees for nearly 20 years. During the COVID pandemic in 2000, I experienced a financial hardship due to lack of customers, so I decided to close the restaurant and begin my retirement. During the Lunch on Main Street years, I began to experience life-threatening health issues starting in 2006. These issues were cancer-related and included problems with my prostate, sinus, and colon. Over the next 10 years, I was administered regular treatment to battle the 3 different forms of cancer that I was faced with. The treatment I received was state-of-the-art and well administered. By 2016, things were looking up. I understood that regular follow-ups were expected to monitor the state of my ongoing recovery. In 2017, I experienced a turn for the worse when previous symptoms of my sinus cancer reemerged and led doctors to believe that it had returned. I would like to explain a series of concerning events following the reemergence of these symptoms. During the evaluation, I was given conflicting information between several doctors. These discrepancies led me to question the validity of their diagnosis and added overall confusion. As a result, I decided to begin documenting as much as possible to better understand the situation. As I continued to document these encounters, a pattern of inconsistencies developed. At this point, I began to dig deeper and discovered that important documents were missing from my medical records. This was beginning to have the appearance of a coordinated effort to withhold information that did not reflect positively on the doctors and or institutions they represented, and left me questioning their ethics. Prior to my symptoms returning in 2017, I had a healthy relationship with my family. They offered emotional support and hope during the first few bouts with cancer. However, shortly after my symptoms returned, the dynamics of the relationship with certain members of my family took a turn for the worse, and I would like to explain why. What you're going to see on the screen right now is my cousins and my sisters. And top right is Gordon Ford. He's with his sister Suzanne Watley Ford, and they play a part in my story. But Gordon is the wealthiest person I've probably ever known. I believe him to be worth over $100 million. He has a company called Crosslinks. He has hundreds of employees. Crosslinks deals with thousands of doctors. He also has a company called WebOps, who has hundreds of employees, and he told me they were the best IT people in the world. If the truth is exposed, he would, and at this point should, spend some serious time in prison. This is not what I originally wanted, but this time I certainly do. The first person you're going to hear is Suzanne Watley Ford. She is Gordon Ford's younger sister. And
he's got you here taking care of your mama.
well, whatever. Basically, you know, I want you to keep that copy because I do believe honest people are transparent.
Oh, yeah.
And they welcome an investigation. I mean, if somebody doesn't want an investigation, what does that usually tell you?
They've got something to hide.
Right, they're hiding stuff. Next on the picture, you'll see the arrows pointing to my sister, Carla Emmons, and my cousin, Alan Ford, below. Carla was with me, and so was Alan, when I was told I had an inoperable tumor. And here's Carla discussing it.
Okay. Well, you were also with me when Dr. Chin and Alan, you were both with me when I was told it was inoperable.
Yes, that's true.
Okay. Yeah, y'all were there. Okay.
I think there was a lot of confusion during that period of time.
Okay. Do you remember the biopsy that he took?
I do.
Okay. Do you remember?
After being told that I had an inoperable tumor, my cousins Alan Ford and Gordon Ford and my sister Carla Emmons were going to help me commit suicide. The following recordings will support this fact.
And so at one point, we're all on the same page that you and Gordon and Alan were working on possible suicide for me.
Yeah, I was going to drive you to Oregon for euthanasia.
Well, no, we'd already said that wasn't going to happen because of shipping my body back and everything. Gordon had actually gone on about shooting myself in the chest. Regina's uncle had done the same thing. And some pictures.
What pictures?
You don't know anything about any pictures?
No. What pictures are you talking about?
Okay. No, if you don't know anything about the pictures, there's no point in going any further. You don't remember pictures, that's fine.
Are you talking about your brain scans?
No, I'm not. I'm talking about pictures that I had taken and had framed and had left from my mother and my daughters and stuff. When I committed
Then
suicide.
Alan and Gordon, me and Gordon went and framed those pictures and stuff of the kids and all that.
With my personal messages on them.
Then have no idea. And I had the pocket knife. I guess you gave me your pocket knife that was Daddy's. I gave that to Bland.
That's fine.
You know, but no, I don't have your pictures. I would
And you don't know what happened to them.
have no idea. They
How
weren't-
about my notes? Stuff. Yeah, okay. Okay, you have no idea what happened to them. That's fine, but you and Alan and Gordon were trying to help me get it. We were putting it all
Right,
together.
right.
Because that was...
Did you ask Gordon or Alan
No, I don't talk to them. They haven't corresponded with me. Did you talk to them lately?
at the wedding?
Oh, last year.
The next person to speak on the assisted suicide will be Dr. Boynton.
Definitely, there's no question that they were going to help you with an assisted suicide. That's what their plan was. And
Steph, obviously, Renee said she knew they were trying to help me commit suicide. She knew it. I prove it. Prove that she said that.
no, I know that there was discussion, and Alan acknowledged that.
Yes, the next person you're going to hear is my sister, Renee, acknowledging that she was told that they were trying to assist me in a suicide.
Well, you saw what Alan responded with. You read it last night, Renee. You saw you need to tell yourself. You did.
I know, but it doesn't have to be tonight, Ron.
I know, but Renee, I want you to think about something we talked about last night, honey. We talked about, Alan and Gordon and Carla, at one time, trying to help me work on my behalf. And then I want you to understand at one time they're trying to help me commit suicide. I botched the suicide. They want me institutionalized and getting some help when the day before they were trying to help me commit suicide. Now I'm in an institution and I'm going to get shock treatment.
Ron, that's past. That's past.
As you heard my sister Renee admit to the fact that she was aware that they were going to administer ECT treatment at Ridgeview while I was there. This was the first time I had ever been in a mental institution in my life. But while I was there, they showed me a film on ECT treatment, and in that film it said should not be given to a patient with a brain tumor. I was very confused, but luckily my family got word of it and got involved. The paper in front of you shows that that could very well have resulted in my death. What you will hear is my sister Carla speaking of what she was doing to try to get them to keep from giving me ECT treatment. You'll also hear from my youngest daughter Brandy talking about she had knowledge that that was their plan. And then you will hear Dr. Ralph Boynton saying that he was well aware of the fact that they were trying to do that, and my family was very much involved in stopping it.
They were going to give me DC treatment, correct? Okay. And Renee talked to Dr. Moonjaw.
I went and sat in Dr. Moonjaw's office and almost went to jail to say that my family does not want this, do not want him to have that. So, we're not, I'm not leaving. What happened was he wasn't there. And I said, I am not leaving until I see him, until I talk to him, because this is not what we want for my brother. We're not having it. And they finally got him on the phone. And he was a little wacky. He was asking me about my business and what I do, and I just said, it doesn't have anything to do with my brother's care. We do not want this, and, it's not happening. And then they released you from prison.
Okay. So you talked to him, not personally, but on the phone. Okay. And Renee didn't talk to him?
I don't know.
Because he asked me if I had a sister that was a psychiatric nurse.
Yeah, she must have.
Yeah, according to her, she did.
Yeah, she cried.
Okay. Well, that's pretty
Fight for you, Ron.
Yeah, well, some of it was after the fact, but I mean, I just wanted, everybody to be on the same page. That is a pretty drastic, and I've got paperwork to support the fact that you don't do that to people who have a tumor in their head. Did anybody enlighten them to that fact?
Yeah.
Okay. Well, if you talk.
Hi.
Hey, honey, I didn't wake you up, did I?
I was watching TV.
Oh, okay. I was talking to an attorney. Now, would you be willing to swear under oath that they were going to try to give me ECT treatment at Ridgeview?
I would swear under oath that's what I was told at the time.
Yeah, okay. But I mean, do you believe your sister believes that?
Yes.
Okay. All right. That's what I needed to know.
Okay.
All right.
Love you. Bye.
And then, we all know, I'm not making this up. They want to give me shock treatment. Yeah. My sister called them.
Hindsight is 2020.
Well, no, it's, Renee went crazy when they said they were going to give me shock treatment.
Yeah. And then when I went back at that, I think that was not a good place for you to be. Okay.
Well, it's not a good place for anybody. If you study that facility, look it up. This is a hellhole. It's a shithole.
So when your family kind of got on to what was going on there, that they were going to do the shock treatment, they decided to transfer you to Emory. I think it was Emory. And the point being,
Well, the next recording you are going to hear is my daughter Amber Luder, and what I want you to listen carefully to is at the very end, she mentions that she remembers it very vividly. I hope now I have furnished enough information to where you will believe at one point the psychiatrists at Ridgeview were trying to administer ECT treatment. there were many people made aware of that. And the question would be, why? If I had a brain tumor and it was my first time in a mental facility, why would they want to do that? Well, as you saw, or if you can see up on the screen, it could very well kill me. That would be at worst. At best, I would lose my memory, my short-term memory, and certainly wouldn't have the mental capacity to testify in court. So there was a reason for that, and this is why they're trying to hide the truth. What is the truth? I'm going to play some recordings now that I hope will shed light on what the truth is.
If in fact there was collusion between you, Carla, and Alan and Gordon to commit euthanasia without Ron's consent, that would be murder.
Attempted murder. Attempted murder.
Right.
Attempted murder in the first degree, which has no statute of limitation.
Right. So, and that for anybody to do that, they would have to be evil. So, it's hard for you not to see her as anything but evil.
Well,
That's a hard.
okay. But if it's attempted murder,
I think the attempted murder was probably everybody trying to help you commit suicide. That's it. Now, they don't certainly need to admit to that. What's that? I said nobody needs to admit to that. That's right. I think you have a lot of questions. I think your questions are based in sound reasoning. I think you have a reason, an articulable reason to question what's happened to you in the actions of the doctors. You've obviously done a lot of reading and research on it. You obviously have an inquisitive mind. A lot of people would just pass right over it. You're not that. That doesn't make you loony, okay?
The next person you'll hear speak is my son-in-law, Vince Almoina, who spent many hours trying to help me get my medical records. And after he speaks, you will hear Clay Davis nail exactly what has happened.
My name is Vince Almoina, Ron Cleveland's son-in-law. I've spent the course of weeks sending emails with lawyers trying to help him get his medical records with a pathology report, and up to this date, I have medical records from an attorney with no pathology report included, with a sum stating they cannot explain why there is no pathology report.
But you've already given me one reason why they may not have a biopsy.
They threw it away.
Or either they threw it away and did not send it in, so it may not indeed be discoverable because it no longer exists.
Right.
So, it's all explained. That is the explanation of it. I don't think there is another. Well, that's one plausible explanation. Is that they sent you home to die and didn't see the need to
Right, there wouldn't be a paper trail either.
do the report. So,
As you just heard, Clay Davis, who I spent a full day with, 8 hours, letting him hear many of my recordings. And the narrative that has been set in order to cover up the crime is that I, in fact, have mental issues and am not right. I have many people that I have recorded, including friends, doctors, and family, that confirm the fact that they believe me to be normal. Again, it is the only way they will cover up this crime is for there not to be an investigation and for it be an accepted fact that I have mental issues. I assure you, I do not, and I want you to hear from many people. I'm here with my cousin, Lee Bennett, and I'm going to let him tell you his name and just share some information that he was given.
So, yeah, this is Lee Bennett. I'm Ron's first cousin. In regards to speaking to some of our other cousins, it's been reported that word has gone out from somewhere that Ron's been diagnosed with paranoid schizophrenia. I know this to not be true. I've worked with Ron a good bit here, recording and documenting his previous history, starting from when he was diagnosed with cranial cancer. The only mental illness that I know about was probably, in my opinion, a reasonable response to being told you had 2 weeks to live, and that would be some form of depression. But other than that, I don't think it's been proven or documented with any bit of truth that there's further mental issues. And certainly over the past few months that I've been dealing with Ron as a layman, I've never seen anything that's not reasonable in response to the various calamities that have befallen him. So just wanted to record my opinion on this and what I've heard and what I've seen. So that's my story.
Yes, you just heard from Lee Bennett. Now you're going to hear from Suzanne Watley Ford. Again, you'll hear a common link.
I said, spit shine this place.
I know.
And I would have done that anyway.
What,
I would have done that anyway.
Yeah, and y'all did take great care of it. Mark took care of the yard. Y'all were very patient anytime we had a problem,
Well, and that's what I said to Carla. Because, she would say something, don't talk to Ron, just talk to me because he's crazy. And what? No, Ron's the one that comes and takes care of everything. If there's been issues, he's there, and he hasn't been crazy with me.
The next person you're going to hear is Dr. Diaz with MD Anderson. He references the state of my mental health.
Believe it or not, you haven't been in here being ignored.
Oh, y'all been monitoring the conversation?
We've been actually working about you. No. Let me look in your mouth again. I think we've got some news that's better than we feared, but it's not 100% nothing either.
Right.
And so, first of all, you're not crazy. There is something going on there.
You just heard from my cousins, Lee Bennett and Suzanne Watley Ford, who agree that I am mentally stable. You also heard from Dr. Diaz, a medical professional at MD Anderson, who also supports this claim. However, there are some who do not share this view and are purposely attempting to create a false narrative in regard to my mental state. I believe the purpose for this is to avoid a potential medical malpractice claim and instead paint me as the villain by portraying me as crazy. The document illustrated here is a psych evaluation that was created by Dr. Beitler, a radiologist at Emory Hospital. What most medical professionals find unusual about this is why a radiologist would create such a report. A psych evaluation should be performed by a trained psychiatrist or psychologist who typically administer many tests and spend hours listening to a patient in order to determine the true state of their mental well-being. This is not what happened in this particular case, and such a report has the potential to cause confusion when being reviewed by other physicians. The person you are going to hear next is Dr. Ralph Boynton, a PhD in psychology. I started seeing Dr. Boynton in 2007 when my daughter Amber insisted I take her appointment with Dr. Boynton. At that time, I was going through a divorce and getting over my bout with prostate cancer. We bonded almost immediately, and I enjoyed talking to him and running different issues and situations by him. At one point, he asked me if I thought I needed to continue seeing him. I told him the insurance paid all but $15. He was 3 blocks from the restaurant, and I enjoyed the sessions. When I was diagnosed with sinus cancer in 2009, he became someone to share my journey with. What you will hear next are his comments on Dr. Beitler's psychiatric evaluation that he created in 2017. I believe these to be very telling.
Psychiatric diagnosis from a non-psychiatric professional doesn't carry weight. What carries weight is a diagnosis from a psychiatric professional. Okay. So that's part of it. Okay. Let me finish. Okay. So the other part of, okay, you probably carried the diagnosis forward from previous records. That is legal, but what I'm saying, it's not best practice based on how I was trained. So, best practice is that you don't, unless you do the by history, major depression by history. I did say that. It's as if he made that diagnosis himself based on his personal contact with you. Yeah, there was no personal contact. Right. So that's not good practice, and whether or not that would result in some sort of a consequence, malpractice, kind of a consequence, I don't know. That's a medical. Okay, so what would be the purpose of him sending that information to different doctors if it carried no weight? What is the purpose? What would the purpose be in your mind if it carried no weight? Would you say that, and in there he says it's active, so it has that date on it, it says active, it didn't say history. So you don't think that's somewhat misleading? I think it's lazy at the very least. That he's just sort of taking the path of least resistance and he's cutting and pasting, and so that's not good practice. That's lazy. Okay. In Chandler, in your, yeah, I don't know what the encounter. I don't know what that means in his office. What typically, what it would mean would be a face-to-face encounter. Would that be an appointment or counsel or something? I would think so. Don't you think encounter is a strange word to use on a legal document? I guess it's legal. I guess he can say whatever he wants to, it appears. Right. It's probably whatever the office, however the office does it is the way typically there's some latitude within the office to use. So basically, your friend Pam, the psychiatrist, is saying he can create that document, he can call it active, he can date it for that day, he can claim to have had an encounter with me, and all that is wrong, but there's no problem with that. There's no legal problem. It's not a legal problem, but what you can do is you can call the office and have it amended. So in other words, you point out, based on your contact with me, that was not accurate, and they can contact me to confirm that. And after the cancer treatment, you did not have symptoms of major depression. But Yeah.
8 years later.
Yeah. Yeah.
You don't think that is kind of off the chart bizarre?
Well, I don't know bizarre, but it's not accurate.
Okay, so if it's not accurate, that just means
It means somebody is not doing a thorough job of interviewing you.
well, a thorough job is no interview.
Well, then that's they're dropping the ball.
Well, don't you think me and you have had this discussion? I mean, that was, this wasn't years, this was 2 years ago.
Yeah, I just told you I didn't think you were in major depression.
But do you think that I would make this up, that I would generate this document?
No, I don't.
So you think this is a legitimate document for me to read?
Looks like it to me.
I mean, well, I'm just gonna.
These forms are usually these would not be individualized. This is going to be the same form for any client, and what they mean by encounter is probably defined by the medical establishment that's using that. So it could be contact would be another.
Okay, but I mean, okay, so I just think it's strange. I mean, like I said, if it's a form encounter.
If you were not contacted in those days and you did not have an appointment on those days, that's not accurate.
Oh, I had an appointment for a scan. That is the day that I had the scan after blood down. This is before the call from the doctor telling me they found a lesion on a bone in my head. This is prior to that. This would have been the day that I went down to get the scan.
This probably, the status active,
Mm-hmm.
it should be by history or historically or previously diagnosed. If it's going to be active, if somebody's going to say active, there needs to be confirmation that the symptoms that they're like major depression symptoms are present. So if I don't see you, like say I'm seeing somebody that's has a history of bipolar disorder, they come in and I don't see the bipolar disorder. They tell me they give me a symptom profile that qualifies for bipolar disorder. So I would put bipolar disorder, most recent episode, manic, currently in remission. So there'd be so you would be in remission, or it's sort of this is supposed to be current, and obviously it's not current. It says active, and that's not accurate. That was not active because you weren't depressed, majorly depressed.
Well, not only that, I wasn't having problems sleeping. I wasn't guilty. I had suicidal thoughts or feeling guilty or inadequate. I believe
would have had to interview you to establish that was the case for them to put action on it.
Okay, so if they shared this information with other medical institutions, that would kind of be detrimental. I mean, that wouldn't be to my advantage, would you think?
No, I don't think so.
Okay, yeah. It'd be to my disadvantage.
Somebody should be addressing it with you. If you were if I were a medical doctor and you were to come in to see me about some medical condition, and I know that you've been recently diagnosed with major depression, I want to know about that.
Okay.
Yeah.
Okay.
I'd be asking you questions about that.
Right, okay. Well, yeah, and questions need to be asked. I agree with you. What you're going to hear next are 4 short clips taken from different sessions with Dr. Boynton.
You're going to commit suicide, and I'm going to be careful about how I present it. So, but that's not the case. That is not the case here. To me, the evidence of certainly a broken system you're told on one hand that this is urgent, you need to get something done, and then you're delayed in the response. That you're told mastectomy is needed, and it's scheduled, and then you're told, oh no, we overreacted and that you don't need it. Well, and it turns out it looks like you didn't need it. I'm glad you didn't do it. But the point is you get these contradictory messages that are like, what the hell? This is like not okay.
Yeah, one someday down the line, whether I'm here or not, I would love for you to take all these scans or somebody and find an honest radiologist and ask them, is there any real reason for this mass confusion? It just seems to me that
if you establish a diagnosis, maybe you can get somebody to get a medical...
Right, you would think.
...investigator. Can't believe that anybody's going to do cancer surgery without a biopsy. That's almost is inconceivable.
One of the major issues that I would like to point out are the missing documents within my medical records. In the previous recording, you heard Dr. Boynton say that he couldn't believe they would do surgery without a biopsy. There was, in fact, a biopsy performed by Dr. Chin. In the next recording, you will hear Dr. Boynton say that during a conversation with my cousin Alan, who was there that day, described the results as having the appearance of a jar of worms. There were many pieces of tissue that were taken from my sinuses, which caused it to look that way. The real issue here is that there's no mention of the biopsies anywhere in my medical records. It seems like such an event should be well documented. Okay, where's Alan and Gordon? Can you explain what happened to Alan and Gordon? They were really by me in 2009, and now they just think I'm crazy, so they're not helping me.
I've encouraged you to have direct conversations with them to find out for yourself what's going on.
I did. I called him and asked him to come again. And Alan did come in here years ago, before 2017, and he did concur that his words when we were leaving Dr. Chin's office in 2009, that the biopsies appeared to be what?
A jar of worms.
A jar of worms, okay. Now, as stated earlier, the most concerning issue is the missing report. In addition to the missing biopsy report, there are several medical imaging scans that are also nowhere to be found in my medical records. William Bollard, an attorney at the Penn law firm, was asked to help locate these missing documents. As you can see by the summary letter illustrated here, he was unsuccessful in his attempt. It is worth noting that by law, these documents should be included within my medical records. You are now going to hear from my daughter Amber describe her experience in trying to locate these very important documents.
Yeah, I mean, I looked, I helped you and try to find the record of the pathology report from the biopsy from Dr. Chin's office. And I spent several days calling many times and leaving messages trying to access those records, and then eventually decided to go up there with you in person because we could not get them over the phone or could not get anybody to identify where they were. And then we waited, and they told us after waiting that they did not have any record of it. I told them that would be malpractice if they knew there was a procedure but could not produce the records and results from that procedure.
Okay, thank you. And if you would just talk about the efforts you made to get the original scan in 2009 from Piedmont to take to Herein.
Yeah, I called and requested the imaging, and when I went in person and picked it up at one of the front desks, and we got some kind of disc or CD, but then when they went to open it up, it was not actually your imaging. It was somebody else. So there
Different Cleveland is what Dr. Delgadio told me.
was it. I didn't know the name. I just knew it wasn't yours. It did not match with the records at that point in time for you, and it was not your actual image.
And that was 2009.
It was before your surgery.
Yeah. Okay. All right. Thank you. That was my daughter, Amber. In addition to receiving assistance from my daughter Amber, my younger daughter Brandy and my mother, who are also well aware of the situation, encouraged me to seek legal counsel in locating the missing pathology report. Illustrated here, you will see signed sworn statements by Brandy and my mother acknowledging the fact that very important documents are missing from my medical records. In addition, they were told the pathology report came back inconclusive. This offered the family hope after being told that I was in fact terminal and had a very short time to live. This so-called inconclusive report is the key document that is missing from my records and has yet to be located. Another question that remains unanswered is how can a physician conclude that a patient is terminally ill based on a biopsy that came back inconclusive? Where is this so-called inconclusive report? This simply defies logic. What I am going to play now are recordings of my conversations with Dr. Witcher. Dr. Witcher is a very good and compassionate person. This will become evident when you listen to these recordings. In this series of recordings, you will hear the names of Dr. Cook, Dr. Goen, Dr. Roser, Dr. Kazi, Dr. Diaz. All of these doctors were contacted by Dr. Witcher trying to help me get the medical care that he believed I needed. Again, this is Dr. Witcher, and he has Dr. Kazi, who is a radiologist that he knows that he contacted immediately when seeing what Emory had given me, and I'll let you hear him.
I was just wondering if you could maybe take a picture of it. I'm talking to the radiologist now. Thank you. Yeah, I can.
Well, this will be Dr. Witcher again, trying to find the elusive pathology report from Piedmont in 2009.
Do you have anything with the radiology report? Because we were looking on the disc that you had, and there was not a report on the disc. Okay. Well, if you decide to go to cancer treatment, you just give me the name of the doctor and whoever we need to work with, and I will go down there and I will show them what we're looking at there, so that that you won't be put off again and again. Because as sick as you are of this, I'm sick for you. I'm not sick of you. I'm sick of this happening to you because this is the way it needs to happen. Right.
Hey, doctor. Hey, Herein. Good to talk to you. Good. Appreciate it. I talked to Dr. Diaz, and he said he talked to you earlier today. Yeah, I talked to him just a little bit ago, and I wanted to give him a chance to talk to you and talk about things and see if he had any questions about anything he has been saying. Well, that's why when he said there was a possibility of malignancy, I wanted him to jump on it rather than to keep watching it. Oh, okay. Well, I think probably what they saw on the scan was probably a donogenic process from the inflammation talked to Diaz just a little bit ago, and wanted to make sure that you were kind of on board with the same thoughts. Oh yeah, I'm on board. I've been on board with somebody doing something for 14 months. Yeah, I know. Just trying to get there. Yes, sir. Yes, sir. I know that. So, okay. So you take care, and if you need me for anything, you can call anytime. You know that, right? I do, and I appreciate it. All right. You take care and have a good lunchtime on Main Street, okay? Okay, bye. All right. Take care. Bye-bye.
Dr. Witcher called and spoke to Dr. Roser. He is head of otolaryngology at Emory, and Dr. Roser's office called me and gave me an appointment. I went to that appointment, and now you're going to hear what became of that appointment.
Dr. Witcher. Did Dr. Rosen talk to Dr. Witcher on the phone?
I'm sorry, we don't have, I don't know what that is. We have all the other stuff.
Dr. Rosen here?
Yeah, I just talked to him.
Well, would you ask him if he...
I did, I already asked him. He doesn't recall talking to your dentist, and he doesn't have the interacts from your dentist.
You just heard Dr. Bradshaw say that Dr. Roser had no recollection of speaking with Dr. Witcher. You are going to hear Dr. Witcher stating that he did.
All right. Well, anything I can do, I'm going to be ready to do it. I'm in your corner. I'm sorry about that, because, like I said, right after I talked to you last time, that was when I called and I talked to him, and he's, with Dr. Roser, I talked to him personally, and the reason I know that he got the message is because he said, when he talked to me, and I didn't talk to anybody else, he said he was going to pass that to his receptionist so he could make an appointment for you.
Doctor, they did.
And I'm listening to calls here.
They called me. I made an appointment. Hello? Mr. Cleveland? Yes.
Hey, Ed Diaz from MD Anderson. How are you?
I'm good, Doc.
You got a couple of minutes?
Yeah, I got a couple minutes, yeah.
So I just talked to Dr. Victor.
Yeah, good.
Great guy. He seems to have a good understanding of what's going on, and we basically agree. Let me just kind of fill you in. You know, you're after having had the cancer you had, your story is very typical of what we say is osteoradiocrosis, bad bone, dead bone from the damage caused by surgery, radiation therapy, multiple treatments. The problem with you is that when we got this PET scan, we're not 100% sure it's just osteoradiocrosis. The radiologist that read your films says that this could be a neoplasm. Now, what does that mean? Neoplasm just means a tumor. It doesn't mean it's cancer. It doesn't mean it's, it just means that there's a growth there more than just osteoradiocrosis.
You just heard Dr. Diaz speak of his conversation with Dr. Witcher. The next recording is Dr. Witcher speaking of the same conversation that he had with Dr. Diaz.
Hey, Doctor. Hey, Ron. Good to talk to you. Good. Appreciate it. I talked to Dr. Diaz, and he said he talked to you earlier today. Yeah, I talked to him just a little bit ago, and I wanted to give him a chance to talk to you and talk about things and see if you had any questions about anything he has been saying. Well, no. What did you tell him? Kind of run it by me what you told him. Well, what I had told him is that, first of all, we had seen the CT image that we had here from almost a year ago now, and then the one about 6 months ago. And although there hadn't been a lot of change in that, when he's talked to me about the PET scan and the changes they saw in the PET scan, I think that it's probably best to go ahead and have something surgically done there, because at some point you will most likely need that anyway, whether it's even if it's something that's non-malignant, which there's a reasonable chance that it still could be a non-malignancy with the bone loss that we have and the radial necrosis. There's likely going to be anywhere to be a
malignancies there. It looks like to me they would have jumped on it a lot harder. You know, they seem to continue to imply that there's, you know, at one point he said, you know, you have a tumor, then you don't have a tumor. And when I talked to him, you know, there's a possibility of a malignancy. So I've been confused now for 14 months. And
well, that's why when he said there was a possibility of malignancy, I wanted him to jump on it rather than to keep watching it.
Oh, okay. Well,
I think probably what they saw on the scan was probably a donogenic process from the inflammation where you've had the bone loss there, and that where that bone loss goes up into the nasal cavity and into the sinuses there. So if I had to bet on it, I would probably bet against malignancy, but since it can't be ruled out, I would feel more comfortable if it were me going ahead and having the surgery, because at some point you're going to likely need that anyway with the amount of bone loss that you have up there.
that's exactly what Dr. Cook said. He said regardless of whether it's malignant or not, major bone surgery is in order. And that's where, you know, I keep getting all these, you know, kind of conflicting views or opinions. So that's why I asked them to talk to y'all. But okay. But he, you know, he's talking about being out there a month and having, you know, some speech therapy. So, you know, it's a long way from waiting 6 months to what he's talking about doing now. But whatever, you know, if it needs to be done, I see no advantage into waiting.
I don't see any advantage into waiting either. It's going to be something that's going to need to be done at some point, whether you wait or not. So I would, if it were me, I would want to, number one, eliminate the possibility of a malignancy, which I still think is kind of on the back burner, but it's a possibility. And also, waiting longer is not going to make the healing process any easier.
Correct. Okay.
So my suggestion to him was to go ahead and go forward with a surgical procedure.
Okay. Well.
You have heard Dr. Witcher speak of talking to Dr. Roser and then speaking with Dr. Diaz. And now you're going to hear him talk about Dr. Cook, who is an oral surgeon up in Gainesville that he knew, and he sent me to see.
Hey, Dr. Witcher, Ron Cleveland again. Hey, Ron, good to talk to you. I'm trying to get in touch with Dr. Cook today. Left a message for him. I haven't heard back from her yet, but I did talk to him, let's see, it was Tuesday of this week. So, have y'all talked, what was discussed? Okay, yeah, he did call me. He was nice. He called me late, but I appreciate him calling me. He said that y'all had gotten together, I think, it'll be a week ago tomorrow. I think it was on Thursday. And he said y'all got together and looked at the scans for about an hour and a half. Yeah. Okay. And what scans, you know, he said he looked at his scans, you know, his recent scans. You know, he did a Panorex and a CAT scan. With the same piece of equipment. It looked like, you know, your Panorex, but at one time she put like, you know, a lead shield on me, and the other time she didn't. So I guess that one machine does both. But what did y'all compare? Did you compare what you found, you know, in May? I showed him the ones that we had in May and the ones that we had later. I think it was September, October, or somewhere around that. The ones that were like I mentioned to you, that I didn't see a huge change there. But again, we are dealing with some bone loss there. And the question is whether the bone loss is a malignant process or not. And I guess that's
you are going to hear now is Dr. Cook, an oral surgeon, describing why there's a need for hyperbaric treatment before removing teeth from a patient that has received head radiation.
If you go in and create a surgical wound, it can make the osteonecrosis a lot worse because that bone can't heal. It doesn't have a good blood supply. So normally, if we're going to be doing much surgery on somebody who's had radiation treatment, we have them do hyperbaric oxygen treatment first. I think we talked about that some. And what that involves is it's just like a 6-week thing. You go in every day for 5 days for 4 weeks, and you lie down in this chamber. It's kind of like a tent.
Oh, I've seen them. I know exactly.
So you know what it is. Okay, so you lie there for an hour or so, and you get like what's called hyperbaric oxygen, which is concentrated oxygen that's forced into your body and into your tissues. And the purpose of that is to try to reoxygenate that part of your body as much as you can. So then if you do surgery, you've got enough oxygen and enough blood supply for it to heal. See, blood supply is what makes things heal.
As you just heard in the last recording, oxygen therapy is considered a standard course of treatment because it accelerates the healing process. In some cases, failure to adhere to this course of treatment can lead to devastating results. In the following audio clip, you will hear Dr. Cook describe such an occurrence.
I've seen patients, they call it osteoradionecrosis. That the osteo means bone, radio means it's radiation treatment, and necrosis is death. So it's bone death from radiation. You can go in and do something real simple on somebody, like take out a little tiny tooth, a little lower incisor. To take out a tooth that big. And 6 months later, they've lost the entire front part of their jawbone.
Dr. Witcher sent me to see Dr. Going, another oral surgeon that was a personal friend from his Emory College days. Dr. Going refused to remove my tooth. This is a recording between me and Dr. Witcher right after I left Dr. Going's practice.
Dr. Goin, and he didn't remove my tooth. I showed it to him, and he said, well, yeah, I can remove the tooth. That's not a problem. I was more concerned about the upper than the tooth there. Yeah, well, I still am, to be perfectly honest with you. Yeah, me too. But he,
Dr. Witcher was contacted in my presence by Dr. Beitler, my radiologist, who told Dr. Witcher I would need dental trays to soak my teeth in following my 7 weeks of head radiation. Dr. Witcher did that, and after my treatment did extensive dental work that included extraction of many teeth. Never did he mention hyperbaric treatment or the need for hyperbaric treatment. On the next recording, you'll hear Dr. Witcher say that hyperbaric treatment is not available in the Gainesville area. The illustrations put on the screen will show that this is not true.
yeah, I'm just trying to get back in touch with you, see what you found out. I talked to some of the oral surgeons here, and the thing about using a local oral surgeon is if we have to do hyperbarics, there's not hyperbaric chambers up here. I talked to the chairman of the department, well, I left a word to the chairman of the department of oral surgery down at Emory, and I've worked with him before on some cases, and they have a hyperbaric chamber there, and I'm just waiting for a call back from him to discuss your case with him before I continue, but I wanted to talk to you about it.
As you can see, there are many available hyperbaric treatments in the area. One of them happens to be at the North Georgia Medical Center. This is literally blocks away from Dr. Cook's practice. Dr. Cook was consulting with Dr. Witcher on my treatment. As you can see, Dr. Witcher has outstanding credentials. I believe Dr. Witcher to be an outstanding dentist who made a bad mistake. Now you are going to hear from Dr. Boynton, who explains what he thinks has happened and why Dr. Witcher would lie to me.
Explain that to me.
I can't explain that.
Okay.
We speculated that he might be covering his ass about that what he should have known was that given that you had radiation of the
head,
that made you vulnerable to osteoporosis, and that the treatment for that, or at least the preventative measure, would be for you to have the chambers,
hyperbaric chamber before and after.
yes. So he should have known it, and that if he pulled your tooth without that treatment, then he would be putting you at risk for osteoporosis, which would be a big mistake, potentially malpractice. And so it's possible that he, in recognizing what he had done, sort of lost, sort of like, I don't know anything about hyperbaric chambers, that so he's covering his ass. That's a potential explanation.
Dr. Witcher told me that Emory had missed the beginnings of my bone deterioration in a 2015 scan. And again, in 2017, it had progressed and nobody had brought it to my attention, or they had totally missed it. He also said that the biopsies taken by Emory in 2017 were from the wrong area, and Dr. Cook, an oral surgeon, agreed with him. How accurate can a biopsy be if it's taken from the wrong area? He also set me up with Dr. Roser at Emory, and I went to see Dr. Roser. When I got there, I was told that I did not have an appointment and that Dr. Roser had no recollection of talking to my dentist, nor did he have any pictures or scans. I got back in touch with Dr. Witcher. He assured me they spoke for over 15 minutes and he was dumbfounded. Given this, I'm asking anybody listening, would you want to go back to Emory for any kind of treatment? In this recording, you will hear the names of 3 different doctors that Dr. Witcher has talked to concerning my care. One is Dr. Kazi, a radiologist. 2 is Dr. Cook, an oral surgeon. And 3 would be Dr. Roser. He's the head of otolaryngology at Emory. Please take into consideration that Dr. Witcher spent a lot of his time trying to help me. He was not getting paid for his time. He did this voluntarily. Never did I ask him to get involved. His staff told me that Dr. Witcher was very concerned about my medical care, and he did not understand what was going on.
Until you take a sample and see it under the microscope, that's what we're betting, that's what the odds are, but I can't tell you that for sure.
Yes, I understand, the biopsy is, even a biopsy isn't certainty, but I guess it's as close as certainty as you would get.
And the thing is, the biopsy is going to depend on where it's taken from.
Correct.
Which was when I talked about Dr. Cook, was when I said, they took it from the buccal and from the cheeks, from the outside of the tooth, rather than the inside of the tooth, and the inside of the tooth was where the lesion is.
Right, and that's where, was it Dr. Kazi, is that right? Kazi?
Yeah.
The radiologist.
So what he looked at, he said, certainly concerned him. So,
yeah, and it's concerning to all of us there. And the question is what it is and what do we do about it. If you decide that you're going to give Rosa or Emery a chance, I will actually take that down there before you go, and I will sit down and talk to Dr. Rosa and show him what we had talked about. But if you want to go somewhere else, I quite understand that too.
Okay. Dr. Cook, if y'all look at an hour and a half and he thinks, we need to move on it, we'll be moving on.
I think we do need to move on doing something, because we need to first of all find out if it's a necrosis of the jaw or if it is a malignant lesion.
Okay.
Okay, that's step number one. And once we have that answer, then we can start to work with how we repair the bone that's lost in the damaged bone.
Okay.
Because again, and I went over this with Dr. Cook, and I showed you that you can see where the bone is lost that goes up into the floor of your nasal cavity, and I think that's where your nosebleeds are coming from.
Oh, it's gotten worse. I've got more blood coming out now than ever.
The next recording, you will hear Dr. Diaz talk to me about the need for surgery. The surgery he's discussing is called a mastectomy. As you can see by the pictures, no one in their right mind would want to have this surgery done if they didn't think it was completely necessary.
It's going to cause you enough trouble that eventually you're going to need surgery. On top of that, there's the possibility that this is a tumor, and not just a bad, infected, dying bone, but a tumor. And so the treatment for that is surgery as well. And because you've had so much surgery in the past and radiation therapy, when you have surgery, reconstruction of that defect is going to be necessary. And typically what we would recommend in such a setting is what we call a free flap. In other words, where we take tissue from somewhere else in your body to fill in the defect. What we used to do with patients like you is just leave a hole there, put a denture, and the denture works just great. But because of the treatments you've already had, that's just not going to heal very well. And so by putting in new tissue from either your leg or your arm or your thigh, either bone or soft tissue, we can get that to heal better. And so surgery in you kind of solves two problems. One, it takes out this bad bone, and two, we figure out if you have a tumor in there and we take it out and then reconstruct it.
As you're going to hear now, you will hear my daughter Amber say that this is only going to get worse. She was absolutely right. As you can see by the movement of my teeth, all I've had is additional bone death. This is what I was told by Dr. Witcher with his last x-rays, that the movement of my teeth is due to dead bone.
And I agree this surgery needs to happen, but if MD Anderson is not going to do it, then we need to find people that are going to do it, and we need to quit running in circles because it's getting worse, and it's exhausting for you and for all of us.
At this time, I believe that my osteoradionecrosis is the result of the removal of many of my teeth and extensive dental work performed by Dr. Witcher. He should have known of my need for hyperbaric treatment. I simply want my friend, Dr. Witcher, to admit to his mistake, apologize to me, do everything he can possibly do to help me get the treatment I now need more than ever.